Good morning, everybody. This is Pete Doyle here. I'm just going to wait a couple more minutes because I'm conscious that we did invite people in for 12 o'clock and my trusty computer tells me it's a couple of minutes before at the moment. So just want to wait out and allow others to join us as and when they can. For those of you who are on at the moment, if you've got any questions or anything that you wish me to, please type them away. I should be able to see them. If I'm not, I've got some trusty colleagues in the background who are able to also pick up on messages and pass them through to me. Good morning, Chris. I'm just waiting for a few seconds more to proceed. Morning, Bonnie. I've received your messages, so I will include those in the briefing session later on today. Morning, Martin. Afternoon, Ian. Made it afternoon already. Okay, ladies and gents, let me do a very, very brief introduction as to what this session is about today, and hopefully we'll be able to then proceed. And see there's a fair number of people already signed in, so I'm conscious that time is precious for everybody. My name's Pete Doyle. Some of you may have already previously met me as part of the citation team. Health and safety function within citation, and so I'm responsible for just over 80 health and safety practitioners that service clients throughout the UK. So that's anywhere and everywhere. So we conduct site inspections, visits, we provide advice line teams through my managers and so on and so forth who provide a lot of valuable service to our clients. My team have a great deal of experience in dealing with everyday health and safety issues, and that's not me dismissing the severity of where we are at the moment with regards to COVID-19. COVID-19 is most definitely not an everyday situation. However, what I want to stress to everybody is that what we can do is use some of our basic good practices that everybody has in place day in, day out to help minimize the opportunity for this horrible virus to impact your workplace and your staff, so that we do everything that we can to keep people as safe as is physically possible. I want to stress one thing to you all. I'm as you can tell by the video, a long in the tooth, seasoned health and safety practitioner. And you know, my skill set is in providing support and assistance with individuals with regards to health and safety and interpreting the various pieces of legislation that are out there. What I am not is a clinical medical practitioner. So if you've got questions on me on clinical practice, I will struggle to answer those. However, there will be some questions that you ask me that I'll be able to deal with from a health and safety standpoint, and going through various elements of, you know, how to be as safe as you possibly can. But the judgment call of clinical practice will always come down to the advice that you're receiving from organisations such as Public Health England, the NHS, Scotland, and so on and so forth, various different parent organisations that will give you really first class and quality advice on how to deal with the clinical side of things. What my proposal is today is to actually go through things with you and help you identify some of the things that you can and should be doing from a day-to-day practice to help you now with regards to issues that you are facing. Now, it is slightly different because as you can tell, I'm working from home. This is the wonderful scenery in what I've now converted into my office. So please forgive me. You see all of these intelligent people on television that have got masses of books up behind them. Well, unfortunately, I've got a blank wall, and I'm quite pleased it is that way at the moment. So what I want to start off with is some questions that's already been put through to me earlier today, and please forgive me if I don't name check everybody as they come through, but these are genuine questions from some of you who have already registered an interest in today's session. The first one, I think, actually it covers off a lot of fears that lots of people have, and that is, do I need to make any amendments to my risk assessments during COVID-19? The simple truth of the matter is that we should always be reviewing risk assessments. A risk assessment is written in the spirit of what we're actually facing at that point in time. And, you know, there are quite a lot of controls and various other things that people should be doing with regards to risk assessments. And all I say to everybody is always consider the 5 steps to risk assessment, which is, you know, first and foremost, identify what the hazard is. Well, quite obviously now, with COVID-19 on the horizon, that is a significant hazard that people would never have considered previously. So you may need to change your working practices to accommodate some of the things that we're being advised from best practice, from the government advice and HSE and so on and so forth, who are telling us, please consider these things. So that's your first element. Consider the hazard and what has the ability to cause harm. And in the past, that may have been completely different to what it is today. So that's the first piece of it. Then secondly is considered who could be hurt or harmed by those hazards. Then assess the risk. You know, you as organisations are the best placed people to assess the physical risk in your business, in your organisation, in your workplace, whatever it may be, and make adjustments. It may be that you already had fantastic controls that covered, such as, you know, risk from exposure to a virus. If not, consider what you need to do to change things. And then what I would strongly urge everybody to do is engage the workforce. You know, once you've done this, engage them with what we plan to do, what you plan to do, how you're going to make things better, and then move into things and say, right, okay, here's what we're going to do, and communicate that out to everybody that's in the workplace so that everybody that's impacted by it knows what's happening. And then continue to monitor and make sure that what you're doing is actually working. Actually fall together quite a lot in that if you've got something in your workplace that needs to change it quickly, but make sure that you engage other people with regards to how you make sure that people are taught to. And it may be that you've got a remote workforce. It could be that you've got people who are working at home for the first time in a considerable period of time, and making sure that they've got the controls in place to working at home. One point I do want to make with regards to questions that we have been posed is with regards to DSE assessments for people who are working at home. There has been clear guidance issued by the HSE and other, you know, health and safety bodies that have said that it is a temporary work solution. It is not intended to be a long-term solution. Therefore, so long as individuals are being sensible about their workstation as is at that time, then it is permissible not to have to go through the full workstation assessment. In other words, make sure that the chair is suitable and sufficient, bends and folds in various angles. But please be aware of the temporary fix. That is a very temporary fix. There's a question here from Adrian. Let me read it through first. We have recently furloughed a number of our staff. However, can you please advise if I still have employees working in the field, essential workers that contact coronavirus or at least show symptoms that they believe they're caught working on sites? Do they then go on SSP for the duration of the illness, or can you furlough the team from that point? Right. There's 2 elements there, Aidan, and I will deal with the health and safety element of that. Because there's also an employment law question there. And what I'll do, I'll ask one of my colleagues from the employment law team to contact you with regards to that separately. But with regards to individuals in the workplace who are identified as having been either exposed to or have a member of the immediate family who are exposed to, they should be removed from the workplace as soon as possible. And if that can be done so that they then self-isolate, so that they make sure that they are then not in a position to cross-contaminate and spread the infection to other people. So that's the very simple answer from a health and safety practitioner's point of view. With regards to the SSP, that's something that is outside of my skill set. However, I'm sure that I've got colleagues that will be able to pick up on that one for you and make some sort of contact, or we'll put it on. My colleague Gillian McAteer ran a similar session last week, and I know that with regards to putting people into furlough was one of the popular questions on there. So it may be a matter of checking on our website and having a look to see what the answers were given there. There's two distinct elements between SSP and people that are able to continue working. So I don't want to tread on the toes of colleagues on the HR side of things. I have a question that's just come through to me on a separate stream. Do I need to provide facilities for staff to wash their hands? Well, truthfully, at the moment, all organisations should have these in place under the welfare regulations now. However, it has become more and more crucial that in order to spread or to stop the spread of COVID-19, that hand washing is proved the most effective method to date. We may get changes in circumstances in the future where people suggest other methods of PPE and so on and so forth. But at the moment, hand washing and hygiene is most definitely part and parcel of one of the biggest elements of preventing unnecessary cross-contamination with people. So ideally, you should always have facilities for staff to wash their hands. Now, that may be with traditional soap and water and towels or disposable towels of some description, hand blowers. If you've not got that, then the proper alcohol type gel. I mean, he says reaching across, this is how sad I am. I've always got some in my office with me. But the truth of the matter is that you may not always have that ability in a workplace. But what I would suggest is to have them at your points of entry to your premises and at various key areas where people will be needing to make sure that their hands are sanitized and so on and so forth. It does also touch on another element that we get an awful lot of questions with regards to people. It's about close people come into contact with other people, and we're seeing an awful lot at the moment with regards to social distancing. In some organisations, that's quite straightforward to work with. People, you can isolate them, make them work in an office on their own, or they work from home, therefore reducing the opportunity for people to actually get themselves in contact with other people. But there should be some consideration, and again, this comes back to the element of risk assessment, that you assess the risk, and if there is a risk of people gathering in an area, then sometimes there's quite simple precautions that you can put in place. We're seeing lots of coverage at the moment from the retailers who are stipulating in the workflow and in the shopping areas, distances that you should keep apart from other people. Now, sometimes that's easier said than done in a workplace, but in others, it shows good consideration and thinking about what we can do and what we should do. I think the first recommendation that is being put out to all sorts of organisations now is stop all unnecessary visitors. And I include my team in some of that. That some of our clients quite rightly say, we don't want an inspection at this moment. Can we postpone it, or can we do it remotely? Can we do it by video or whatever? And we're engaging, as myself and others are engaging in those practices. But if possible, prevent the visitors from coming to your site in the first place. So that's your first course. And then have a look at what controls you have in place when people are there. Lots of organisations who traditionally use 2 people to transport goods, they will never get the social distancing in a cab of a vehicle. So they need to find other means of doing it. And some people have worked around that quite successfully, in that they'll send a vehicle with one person in it, and then another person will join them later on for a task. But again, trying where possible to keep the distancing to the 2 meters or the 6 foot rule, so that people do not come into close proximity and contact with others. One thing is with regards to travelling to work, again, this brings up social distancing. Traditionally in the construction industry and, in the cleaning sector, where you will have a group of people going to a property or an office block to do the cleaning or any facility, they will travel together in groups of 3, 4 and 5. That makes obvious sense when you're trying to keep your cost levels down. What we are strongly urging people is, where possible, review your transport arrangements. If people are cohabiting, then that actually gives you some sort of control, because they're already living together. So if you know, they're both clean and both clear of the virus, then that's fine. But again, it's a matter of addressing each situation as you come across it. We're seeing an awful big uptake, especially in engineering workshops, where people are being quite to it, and that's fantastic. You know, that helps people become fitter and healthier. But the truth of the matter is, then, as the organisation that's doing that, you need to consider where people are placing their bikes for safety and so on and so forth. But it's just a matter of monitoring and making sure that whatever your process is, you may need to go back to extreme basics and say, I cannot physically do that job unless there's 2 people there. So then it's a matter of reviewing and making sure that what you are doing complies where physically possible with social distancing, and making sure that you're taking whatever steps. You are then allowed to consider what PPE you use. You know, that it may be that you introduce PPE as a practitioner, and we always encourage people that PPE should be the last resort. Whereas we're seeing a lot now where people are saying, well, if I use some form of face mask or something like that, am I allowed to get more people together? You are, but you've still got to consider the social distancing. You've also got to consider, is the face mask or whatever that you're providing to those individuals suitable and sufficient? So you need to assess. And, you know, there's a lot out there from organisations such as mine, such as Citation, the HSE, and various other manufacturers of these sorts of products, to give you guidance on what is suitable and what is not. Lots of information out there. But I want to cover PPE, personal protective equipment, and RPE, respiratory protective equipment, slightly later. Question with regards to, just coming up on my screen from Bonnie, with regards to, should we be double bagging after use of PPE? So I'll cover that in a moment. That becomes a clinical issue. My observations on that would be, it depends on whatever the individual is exposed to at that point in time. There were probably people may recollect a long time ago with regards to the HIV outbreak and so on and so forth, there was guidance issued to funeral directors and so on and so forth with regards to how to safely handle individuals who passed away through to HIV. This would be, I would presume, in the care industry, where you are dealing with an individual who may have other illnesses and so on and so forth. So it may well be a very good practice. I'm not seeing any guidance at the moment that recommends that you double bag, but the truth of the matter is that if it is live, and the indications are that it will stay viable for a period of hours on a surface or on product, so then it makes sense to at least to ensure you at least bag it. It's whether or not you then double bag. I think that's for you as an organisation to determine what is the risk. You know, going back to the hazard and the risk assessment, and therefore what is our safe working practice moving forward. Question here coming in, please forgive me, I don't know the name of this individual. My business provides services to the NHS. Can we remain open if we implement social distancing measures? Again, looking at what the essential and non-essential businesses are there, because it may be that it's a secondary or tertiary support to the NHS. I think that you would find that you would be encouraged to do the social distancing and making sure that people keep the distance. The important piece with regards to all of this is, what do you do when people don't? How do you deal with the individuals who fail to adhere to the social distancing? You know, it may be, you know, we've seen it in some units where they have a security guard, or the staff are actually following people through and saying, excuse me, can you keep back, can you keep distance? But it may be that you have to discuss that with your client, or with your customers, or whoever they may be, and say, ladies and gents, this is what we're doing and why we're doing it. And often, if you communicate in advance to people, the vast majority of people will actually take that on board, that sentiment on board, and say, yeah, that makes perfect sense, I can understand that. But you need to have a control in place that says, what do I do when they don't? What's the outcome likely to be? So what we don't want is confrontation, and we actually want people to make sure that everybody's keeps the camp for everybody else. Okay. Oh, it's a similar question, but it's the other way around on this one. If my business is classified as a non-essential business, but I can put social distancing measures in place, can I remain open? This steps beyond the bounds of health and safety, but my advice there is that if you are on the prohibited list, and the government keep amending the list, so please pay attention to whatever the local guidance is, particularly. And I think we will see this coming into action more as we go through the peak and over the peak, is that more and more organisations will then be given authority or permission to reopen. My advice to you as a safety practitioner at the moment is, if you are on the prohibited list, in other words, places of public gathering and so on and so forth, that you would be going against the government guidance, and that's never a good place to be. So my suggestion to you is, when you are in a position to reopen, consider those elements with regards to having good social distancing in place as things progress. But my honest advice to you at the moment is, if you're on the non-essential list, then you should be open. Sorry, if you are on the essential list, you should be open. If you are on the non-essential list, or in the list that says you cannot open, you should not open, regardless of what the steps are that you can demonstrate. That's as a business face to face. There will be organisations that we all deal with, engineering and so on and so forth, who will start to gear up things as people start to come back to it. So that would be quite important, to make sure that you are able then to say, this is what I'm doing, and this is how I'm assessing it. So my truthful answer there is, if you're on the non-essential list and it's prohibited, you should not open. But those lists vary and change as we get more and more information from individuals. Hold on, I've got a question. It's awkward trying to use a screen that you're talking to in a different screen. Further question: we work in people's homes we care for. Should we put up any guidance with regards to the work that we are undertaking? Again, this comes back to careful management of your risk, making sure that individuals who are, this is predominantly domiciliary care. It could also be cleaning of organisations, cleaning of homes for individuals. So it's a matter of making sure that you understand what the risk is of those individuals that they pose to you and your workforce, and recognising that. Again, this comes back to the almost a care plan in a domiciliary type environment, but it could also be that you've got certain procedures that you've got, and you then make sure that those individuals are adhering to that for their own safety and for the person that you're caring for. Hold on, I'm just trying to get a message up. Please forgive me, I'm just trying to read through the screen. It's really awkward trying to move the mouse around and read the screen at the same time. Right, the question, I can't read who it's actually from, is with regards to when people are working on a third-party site and the welfare provisions provided. Usually, this comes under the proviso of whoever's the person looking after that site in the first instance. Should be them, the welfare facilities. So that would be, hand washing, rest facilities, suitable areas for you to consume your lunch or whatever it is. But it may be that you need to communicate with the individual organisation that you're working alongside or for, and say, are we permitted to share those facilities? Because that often is the easiest way of doing it. But it may be that you then bring your numbers of people up and their numbers, so that there needs to be a staging or a staggering of when people take their breaks, because obviously what we don't want is inadvertently trigger the social distancing, where we get too many people in a room at the same time, or too many people at a pinch point, such as entering the room, leaving the room. So again, that may mean sort of coordination between yourselves and whoever the organisation is that you're working for. But again, it comes back down to communication with each other and making sure that people are aware of what is happening and what risk you're bringing in, and vice versa, what risk they have. It could be that the welfare facility is brilliant, but it has a severe limit on how many people. So you may need to stagger your working relationship and say, right, so in that case, we will work from this period to that period and then change our working practices around to suit. So again, it's a bit of flexibility in there. Oh, good question. I've just had a question come through to me with regard to fire and fire risk. This is something that people often miss out on. I mean, hopefully everybody's well aware that since 2006 that there's a requirement for every organisation to have a fire risk assessment. And as more and more organisations go into more and more staff being off on furlough, and they reduce and shrink the workforce or even close the workplace down, that there is an element of risk with regards to fire, that people would have assumed that you would have a certain occupancy level within your building when you're operating. So similar as I've indicated with regards to risk assessments, you need to review your fire risk assessments, because it may say that this building, this organisation has 30 people on it. There will be 3 or 4 fire wardens on different levels of the building, different areas. But because they're no longer in the premises, you've lost some of your eyes and ears. So it may be that you need to review your fire risk assessment and actually stipulate, here's our controls that we're going to put in place for this part of, while we're dealing with COVID-19 until we're back up and fully functioning. As with all things, it's more often than not that key individuals who do certain tasks for you will not be there. So it could be that whoever's been doing your fire alarm test or your sound alarm test or your checking of your fire doors is no longer in the business. So it may be that things actually start to fall by the wayside a little bit there. The truth of the matter is that obviously insurers will view, did you have suitable and sufficient controls in place, and it's to be able to justify how we covered it or how you covered it in that intervening period. So with regards to fire, truthfully, it's review your fire risk assessment. Obviously make sure if you were given any actions from your original fire risk assessment or your original reviews that you dealt with those. But consider what the changes are to your working practices. It could be that you've now secured a part of your building that wasn't previously secured. That could be that's where one of the routes of escape is going to be. So it's a matter of making sure that you actually consider the bigger picture with regards to potentially mothballing a site, mothballing a location, picking up on fire. There's lots of things to consider with regards to fire. So hopefully I've covered that one. The other element of that obviously is you record your changes and make sure that you've got a factual reason as to why you've made the change, and communicate that with everybody that's then within the building. And don't forget, you may have an impact in a shared tenancy, a shared building, where your impact may be on somebody else. So please ensure that you're communicating with those around you. Most definitely communicate with all of your staff, but anybody else that's impacted. So. Actually, got a question just coming through. Please forgive me while I take a quick mouthful. Question coming through with regards to close down procedures. There's lots of organisations who are closing down, and unfortunately that's inevitable at the moment. And what we're encouraging, and lots of organisations are encouraging, is that people actually consider how to safely close a premise down. Now, whether that be a factory facility, office facility, construction site, there are various elements of all of those that people need to consider every single time. So, I would suggest that, in no particular hierarchy of control there, but, have you left all your appliances safe? So if electrical equipment is left plugged in, is it crucial that it's left plugged in or isolated and turned off so that there's no fire risk from that? Second element would be control of gas facilities. So in a kitchen and so on and so forth, make sure that everything is turned off gas wise. If you're in a construction site, it may be that there's gas bottles lying all over the place. Again, corral them, put them into your secure stores and so on and so forth. Make sure that people have actually closed the facility down properly so that we actually make it safe. Have you contacted your suppliers? Have you told your clients and suppliers, by the way, we're closing down now? Because the last thing you want is people coming and delivering things, assuming that you're going to be reopened in a short period of time, so that we can make sure people aren't endangering themselves by putting trip hazard and so on and so forth outside a building. And also there's the potential for loss of property there. So it's just a matter of making sure that you keep your key suppliers. The other element that a lot of people do tend to miss out on, who are the key points to contact when a building's closed? We face this every year at Christmas and at Easter typically, but this is something that may be lasting for a period considerably longer than the 10 days that we traditionally see at those. So it's a matter of put somewhere saying, who are the key contacts? In other words, contact Pete Doyle on this number if there's an issue here, or contact somebody else if unavailable. So you've got an alternative means of people making you aware if there's something wrong with the premises, or if they detect something that they think there's an alarm or something else sounding. And on the topic of alarms, make sure that your fire alarm is still functioning and working, and more importantly, make sure if there's any faults identified that they're dealt with. I am fairly certain that fire engineers and fire servicing people are still deemed to be in the essential workforce, so you will find organisations who provide that cover for you will still come out and deal with it. No person from experience within our group that we're still doing that, and obviously once we've assessed the risk, that people will go out and deal with those alarms and so on and so forth. But again, it's just a matter of making sure that people are aware of it. And then obviously continue with routine checks and premises to make sure that the premises are still safe. Question coming from Patricia: how can we meet the statutory security and safety requirements in our lease as staff are not in the office? Okay, I think some of that I may have just answered in the previous section there, Patricia, but the statutory element of that would be with regards to the statutory requirements would be gas, if you've got passenger lifts and so on and so forth, to make sure that they are still being assessed within their normal regimes of inspection. So if it carries passengers, it should be every 6 months that there's what we call a thorough examination. That may fall as part of your landlord's responsibility, but as and when you reopen your premises, it would be a matter of checking with your landlord. Can you assure us that these statutory inspections have still been undertaken? On our website, we have some guidance there with regards to what are the typical statutories, but the predominant ones that come to mind are gas safety. So the gas appliances are inspected annually, whereas the lifting regulations and such like stipulate that the passenger lift should be inspected 6 monthly. You then have various other elements that your fixed wiring inspections and so on and so forth should be done within a reasonable period, and that's usually 3 or 5 years. But again, depends on what you're using. I mean, using Patricia's example there, it's an office, so you would normally assume it's 5 years. But again, it may be that we're starting to come to where people aren't there to monitor when their next statutory is. So it may be worthwhile having a look at your risk register and checking out when was the last time this was done. And it's quite simply using the electrics as the example. There's normally an indicator on your main switchboard or your fuse panel to say when it was last inspected, when it's next due. If not, contact whoever your electrical supplier is, or not supplier, your electrical maintenance team, and see when it was that they last did it. Because it's always better to be proactive than reacting to something that's happened where something's gone wrong. So I'd always encourage people to keep their eye on what your statutory requirements are anyway. So hopefully that's answered that question, Patricia. Here's an interesting one. Is COVID-19 reportable under RIDDOR? Us safety practitioners use lots and lots of spaghetti, alphabet spaghetti. So just for the clarification, RIDDOR is reporting of injuries, diseases, and dangerous occurrences. And the regulation recently has been very clear in that it had to be a dangerous disease that was ordinarily identifiable through work. We recently received guidance from the HSE where that interpretation has been relaxed a little bit, in that if there is now a diagnosis of COVID-19 and there is a genuine belief that that individual was exposed to COVID-19 as a direct result of their work, then that should be reportable under RIDDOR. that's the interpretation. The truth of the matter is that, if organisations that use citation for sport, we would always encourage you to talk to us first before you put any RID or event in. But for those who on this call that don't use citation, I would urge you to contact the HSE if you believe you are in that situation. Because what the HSE are trying to do here is get a grasp on where we are seeing workplace exposures, and that is their overall remit, is to prevent and minimise workplace exposure to any disease. And this one's come at us so quickly that obviously some of the regulations may not necessarily capture COVID-19, but they will certainly be covering elements to do with disease. So the interpretation that the guidance we're taking is that it's where there's a genuine belief that because of a workplace activity the person was exposed. Because as we all know, that again, if people aren't exercising social distancing at home, then that may be where their exposure comes from. But the truth of the matter is that, again, we need to be just a little bit cautious, consider what the rules are. But the rules are, we're starting to see, unfortunately, more fatalities in the public service sector. Recently Transport for London and various other bus companies are changing their working practices with regards to their drivers, because there's been, unfortunately, some individuals who've passed away due to COVID-19. So that will be the rationale, and it's perfectly understandable. It's just that as the regulations are written at the moment, that there is a very narrow interpretation, but the guidance we're getting is quite clearly if it's due to a workplace exposure. Want to come on to PPE. One of the elements with regards to social distancing is that sometimes, if people need to work side by side, that you will need to provide PPE. Lots of people didn't know what PPE was up until recently. I think it's on everybody's lips at the minute, on the news and so on and so forth. Personal protective equipment, and there's a sub-branch of that which is referred to as RPE, which is respiratory protective equipment, which is typically face masks and so on and so forth that people may use to enable them to undertake standard duties. The thing with PPE is people need to consider what it is that they're using and why they are using it. A question that came from Bonnie is with regards to reusable face masks. There was a number of questions from Bonnie with regards to PPE, and hopefully I'll capture them all here for you, Bonnie. That you need to consider what it is that you're using, and truthfully, that all sorts of equipment has got what they call they're rated. There'll be a marking, a CE marking, an EN marking, or whatever. Make sure that whatever it is that you're choosing to use is suitable for the job that you're using it for. So using the element of face mask, you may use a one-off disposable face mask, but it will not protect you for everything that you are expecting to be exposed to. So that is normally just a very simple face mask to protect you from the physical airborne contaminants, but it may be that something else is in that environment that you need a higher level of protection, and that's where there are things, they're called FFP3, FFP2, and there's all manner of categorizations of that. Again, there's lots of useful guidance on our website, and there's other information that's readily available from all the manufacturers of PPE that will tell you what it's suitable for. And so that you're then able to make a balanced judgment call on what it is that you're putting into the workplace and why you're using it. Going back to my earlier statement with regard to risk assessment, you need to be able to justify what's what. The other side of that is, we always come down to disposal and cleaning. So again, how are you going to dispose of this? Question that was posed, do we need to double bag? So again, it may be depending on what you've come into contact. I would certainly recommend that it is certainly put into a contaminated bag, or a bag that is then sealed so that no other people can go and rummaging through it, but looking at how people actually handle things. Then on the topic of the respiratory, we're seeing a lot more requests from people who are choosing to introduce a face mask into the workplace. There's lots of discussions going on at the World Health Organization and so on and so forth at the moment. However, the guidance in the UK is that it is not compulsory. That may change. Who knows what's going to come in the future? And as and when that does, we will provide advice and guidance to to all of our clients as to where that actually sits. But the truth of the matter is that we need to make sure that we're obeying what we're supposed to do and the rationale behind it. There's a lot of different face masks on the market. There's lots of different manufacturers out there. The one thing that I would stress to you is please be careful about who you are buying these products through. Please, where possible, use a reputable supplier provider. There are a lot of indications at the moment of forgeries, and nothing can be more foolhardy than because something is available cheaply. Do you know its provenance? So all I'd suggest to people is verify your sources of product. And yes, there is a shortage of supply at the moment. There is understandably a shortage of supply because we're seeing in the news that the NHS are struggling to get hold of product. That will free itself through in the fullness of time. We're seeing more and more product coming into the UK through approved supply chains. But the truth of the matter is that, where possible, use approved supply chains. Where not, make sure that you've got some form of certificate of identification to say that this conforms. So it's a conformity ticket or whatever it may be that's produced. And you will see, all providing this equipment are well versed and well used to being asked those sorts of questions. There is a question that I've been posed: is should we be using homemade masks made from fabric, etc.? My advice to you is in the home you can use what you wish, but in a workplace you're obliged to make sure that the product that you're providing to your staff or those who you come into contact with meets a standard. And your issue there would be that if something is homemade, how do you know it has met a standard? And again, so I would urge caution in private, individuals taking their daily exercise or whatever, they can wear, often bandit masks and those sorts of things. That's perfectly acceptable. However, in a workplace, there is a higher obligation on you to actually meet a standard. And again, it would come back to this element of potential liability in the future if you didn't demonstrate what you did and why you did it at that time. So I would strongly urge people to make sure that they are dealing with appropriate PPE and RPE and making sure that it's suitable for the job. Oh, here's a valid challenge, actually. What is the case with regards to Northern Ireland? Right, Northern Ireland, for various reasons, has a number of regulations of their own. And, such as I was talking earlier about RIDDOR, that RIDDOR, COVID-19 is now on the RIDDOR list for disease. That is not the case in Northern Ireland. Northern Ireland does not have the same phraseology as we do in the remainder of the United Kingdom. And, that's entirely appropriate because they've got specific regulations that apply to Northern Ireland. So the truth of the matter is, in Northern Ireland, for example, the RIDDOR is slightly different, and their phraseology is very, very different with regards to the disease element. It is beyond any doubt that they're exposed in the workplace. So there is a difference of interpretation there. So again, I would just suggest that people seek guidance and making sure that they're actually talking to the relevant authority to say, right, this is what I'm aware of. It's like there will be guidance come out in the fullness of time, no doubt, with regards to when we start seeing people returning to work. I don't envisage Northern Ireland having different regulations there, but because they are their own enforcing authority, they choose to interpret things slightly differently. So again, it's a matter of being aware of who and what is you're judged by. It will be similar in Scotland, but Scotland under the RIDDOR regs actually abide by the same. But in Scotland, as probably those of you who are on the call from Scotland are aware, that there is a slightly different chain with regards to the care commission. So again, there would be different enforcing authorities that would be bringing things to fruition for various people to look at and see and do. Oh, question on COSH. Sorry, apologies, I've not covered COSH. COSH is the control substances hazardous to health. We may well be seeing a lot more people using different chemicals and products that they hadn't used previously. So again, I would just make sure that people make sure that if you are introducing a new product or a new chemical into a workplace, that they do consider it, that they have a look at the safety data sheets, review the safety data sheets, see what the controls and the processes are for that, and making sure again that the individuals who are going to be using KOSH, using the chemical or the product or whatever it is, fully understand what it's meant to be used, what its dilutions are, and how it's meant to be applied. Because more often than not, if any chemical is handled within its stipulated dosage, it is perfectly safe to handle with the appropriate means of control, whether that be PPE or measurements and separation and so on and so forth, keeping yourself apart from something. But the truth of the matter is that if people are changing chemicals, and that can be for any reason, we are seeing a shortage of chemicals, as I said earlier, with regards to the hand cleanser and so on and so forth. We are starting to see that back in shops now, and organisations who are buying this in bulk have probably seen a block in their supply chain because of people buying lots of it in advance of them. So you may have had to substitute. So again, it's a matter of reviewing what's on your KOSH assessment, and if you've changed your product or your chemical or the dilutions of it, you need to review that. And also, part of, I know I said earlier that I'm not a clinician, but I did attend some briefings before all of this came to light with regards to some of the most effective ways of cleaning are by changing your chemicals frequently, so that you build up, so that the bacteria doesn't get the opportunity to build up a resistance to the product. Yeah, and that was a really, really useful lecture that I attended. But the truth of the matter is that if people are swapping and changing the product, either due to a clinical demand or because they can't get their normal product, it's very simple to assess and make your changes, rather than assuming that it's the same as because it comes from the same supplier. It may have a different concentration, it may have a different dilution point, heaven forbid it may have a different flammable point. So you do need to be aware of these things. So from substituting elements that you are traditionally using, just always KOSH element and your KOSH facts on it. Question here from Emma. What was the answer on side-by-side working? What happens when staff cannot maintain a 2-metre distance? For example, when manual handling smaller, heavy items. The answer was, again, comes back to risk assessment. You can, if you cannot undertake a task safely without obeying that social distancing, you then do need to put into place other controls, and those would extend to using PPE, personal protective equipment, and potentially face masks, depending on the circumstances. But again, it's a matter, it may be, for manual handling, you change the process, you break the load down so that you're able to say, right, it's an individual carrying this now, so you break the package size down to such an extent. I know that's difficult when you're handling heavy white goods and so on and so forth, or pieces of plant and equipment. I know it's very difficult to do that, but it's a matter of changing your working practice or looking to say, can we avoid doing it? If we can, by introducing other mechanical handling aids and so on and so forth to take that product to wherever it needs to be without 2 people lifting it. I am aware that in the industry that come and fit wardrobes and kitchens, that they've stopped delivering because it is typically a 2-man lift to actually bring those those products into your premise or into your home. So we've seen a distinct sea change from that they've actually stopped doing it because they don't want to expose their staff to it. It's where you again come back down to the consideration of how urgent and what is the actual bigger risk with regards to proceeding. Is it essential that it's done? You need to find a workaround, and more often than not, that will be by introducing PPE that ordinarily wouldn't have been considered, or it could be that, right, do I have to change the working practice? Can I change this so that we use, for argument's sake, a sack barrow or some other means of transport so that one person can actually do it? It still poses the issue that people may have consideration and concerns, but again, it comes back down to how do people, if we talk to and educate our teams, then more often than not, they will give you the solution and say, right, here's how we can do that. But hopefully that answers your question, Emma, that if it's got to be done and you can't maintain the 2 metre distance, you need to add other controls and record the fact that that's what you put in place. I mean, one thing I've not covered yet with regards to PPE, people put an over-reliance on PPE. I'm not an advocate of people going on Facebook and so on and so forth and taking everything that they read on Facebook as example of, but there's some really good stuff coming out now with regards to how to safely remove gloves and so on and so forth, so that that people should be using those as guidance. There's lots of information being produced by the manufacturers of the gloves and the face masks and so on and so forth. I mean, we see it on the TV every evening, people wearing face masks, or rather not wearing face masks appropriately. The whole idea of a face mask is that it covers your mouth and your nose. And, you see an awful lot of people who just have it hanging so that it's just over their top lip, so that the nasal passage is still exposed. Again, it's making sure that people are using it appropriately. And as I say, there is an over-reliance on it, that people may assume they've put a pair of gloves on in the morning and they're fine all day. That is not necessarily the case. It may be that over that period of the day that you then become a bigger transmitter, and you turn around and say, well, actually, you've increased the cross-contamination risk there. So the examples I'm trying to give you is consider how frequently people change, and more importantly, why they're changing. It may well be a perception that people wear masks all the time. The guidance is not there at this moment in time to say that's advisable, but it may come. I'm not saying it will. It may come in the future. The truth of the matter is that we're relying on the best guidance that we're getting from Public Health England and various other resources in the UK at this moment in time. We can see some of the things that's changed in Asia and so on and so forth, that they seem to be more comfortable wearing face masks in the public domain. That may well come, but at this moment in time, it is not the recommended route. There is two elements to that. One is that, are the products available? Truthfully, probably not, but that will ease. There will be supply chain issues, and as people come that you will be able to say, yeah, there's going to be more and more of those. But one question here with regards to, I have an employee who's over 70 years of age and in good health. Should they still be coming into work? Right. That's a difficult question for me to answer without knowing the full facts. We are being given guidance from a health and safety and an employment perspective that where individuals meet certain criteria, that they should be shielded. Now, the information I've got sufficient for me to actually say that individual should be rejected from the workplace, because it may be that they are in an essential role, and it could be that their skill set is definitely required. Therefore, the age is not the deciding factor in that. It could be various other things that come into play. However, if you believe that there are underlying issues or that there are capability issues, then again, can I suggest that you would need to speak to my colleagues from the employment law side of our organisation, or seek other guidance with regards to, you need to have a rationale as to why you're rejecting. Obviously, if the individual is in good health and there's no history of heart disease and some of the dominant ones that are coming up for shielding, then you need a rationale as to why they shouldn't be coming in, as opposed to looking at it the other way around. We all know that medics and so on and so forth are being encouraged, those that have retired are being encouraged to go back and work side by side in the NHS. So that shows that age is not the deciding factor there. It's the capability and the other elements that individual brings with them. That they have lots of skills that people don't have. So it's a matter of making sure that people are doing everything they humanly can. Okay. Where has that 55 minutes gone? Blimey, it's really dashing by. Question here, do we need to wait for the government to lift restrictions before I can open my business? Again, this comes back to, it's a similar question to one that was posed earlier on with regards to, if you have social distancing, are you allowed to open if you're on the as a non-essential business? the government at the moment are in the process of reviewing. You know, I see reviews come through multiple times a day as to what the restrictions are and what they're not. Now, you know, that's because that's my job to monitor those things. But the HM government website is really good at submitting things. If you don't already subscribe, then there is lots of useful information there, and you can be selective about where you go and find things. But there's lots of guidance issued to employers of organisations, and you know, to make sure that everybody is reading the same piece of information at the same time. So they're all dated. So I'd always suggest that you review what the latest guidance is. But if you are operating in a I'll use the phrase prohibitive, because that's what they actually say in the regulations or in the guidance that they're given, that it is prohibited to. And so if your organisation is prohibited, you need to be told that it's no longer prohibited. Now, it may be that as we go through this process, that parts of the UK come out of this and others. So again, it'd be a matter of making sure whatever the local area are saying. You know, I live in Derby, it may be that Derby comes out of this after the likes of, you know, Cumbria and so on and so forth, because everybody will be considering what the impact has been in those areas up to that point in time. So it's a matter of making sure that you are obeying the local guidance. So with regards to coming out, you know, opening your business up prior to, I would always urge that you seek clarification with your enforcement authority. You know, that in 9 times out of 10 is going to be your authority rather than the HSE. The HSE are there to provide lots of support and guidance, but it will be the local authorities who will actually lead on that. So I would imagine that as we come through the peak of this, and that we will start to see organisations being encouraged to start the wheels going for coming back into the workplace. You know, and that's the opposite to the close down process then, effectively, because once you've had a period where you've been closed for a period of weeks, you will need to consider, right, what is it I need to do to make sure that the building is safe again? You know, so, you know, the obvious ones are, you know, as always, check for smells of gas and so on and so forth, so that if there has been any leakage or anything that you're not aware of happening in premises adjacent to yours, it may be that there's an impact there. So again, I would suggest that people have a look and say, right, we need to consider how we reopen properly, because often people just make the decision, yeah, we need to do this, but it gets down to, you know, making sure if you are changing your working practices and you need to get PPE in, that you've actually got it, so that the day that you reopen or the day that you function again, you've got everything to do so in a safe manner. You know, because it's not about how we used to operate. I think that as we come through this process, that we will see other things changing, so that this is the new way that we operate. And it may be a temporary issue or it may be a longer term issue, but we need to make sure that everybody's operating and functioning as safely as they possibly can. So again, it comes back down to making sure that where we consider, actually we may want to introduce some additional controls, that we do it. And that brings me right the way back to the very beginning of this with regards to risk assessments. You know, because you may need to review all of your risk assessments anyway and say, right, the world has changed. We need to do this now to make sure that we protect our workforce and our clients and so on and so forth. So it's a simple matter of making sure that individuals review and put into place and make others aware. And remembering that sometimes your actions and interactions will impact others around you. So it may be a matter of sharing that information. You always use the construction site as the example here. You may be working perfectly safely, but somebody next door to you has introduced something that you were blissfully unaware of, and that causes, you know, an enriched oxygenated atmosphere. It may be the same in another workplace, that you introduce something in an office block that impacts others. So it's a matter of communicating with other people to make sure who's doing what and when. So I think I'm coming towards the end of it. Are there any other questions that are popping up that let me have a look. Is it safe for me to allow my contracted cleaning staff to clean my business as normal during the pandemic? We are seeing a lot of organisations who are using this opportunity to do deep cleans, especially if a building's closed. it's actually probably safer to do those sorts of products, those sorts of elements during a pandemic, because, you know, again, assuming that the cleaning organisation's got the staff and the wherewithal to do it. But yeah, I mean, we're certainly seeing organisations that are taking opportunity of this to make changes to their working practices and a deep clean. It may be that, as again I mentioned earlier, as you reopen, that you may need to do some form of clean anyway, because depending on the circumstances you're in, there may be dust and so on and so forth settled in a premises. So it's again maybe a matter of making a judgment call on that. So, ladies and gents, that's me up to very nearly an hour. I don't know where that time has dashed by. Can I just give you some quick context if you are looking for any further information with regards to what I've discussed as topics that you've not been able to get through on your on the screen. You know, I've seen a number come up and dash past, so that's where I've been relying on other people to actually help me. We have two sources of information. The first is through the web, which is www.citation.co.uk, and then /Facebook/ and then that will bring you back through to this, so people can review this video at their leisure, and others. You know, as I mentioned earlier, my colleague Jill did one of these last week with regards to HR, so it may be that I've posed some questions that Jill's already answered. If not, contact us and we're more than happy to share information on the drive and so on and so forth, so that people can see in the public domain on our Facebook pages. And the other one is our contact number is 0161 333 1652. So I'll read both of those again. So the website is www.citation.co.uk/Facebook/, and then the telephone number is 0161 333 1652. My name's Pete Doyle. It's been a pleasure hopefully talking to you today. Hopefully I've made some sense to some of you in the organisations that are out there listening in today. We will run these again in the future if that's what you want. You know, maybe we don't run them for an hour, but we run them for a shorter period. But thank you very much for your time and attention today. Take care all.